Hi, it's Scott Ledger.
And Tracilea Young.
With another medical marijuana minute from Tetra Healthcare. You know, the neat thing is we love talking about medical cannabis, and we love the business side, and we love all the things that are now really starting to take place in the state of Florida. But it's always about that first-person narrative to me, or the miracle cure, or a Charlotte's Web type of story. Right. You have one off the top of your head you'd like to share?
Gosh, Scott, there are so many. That's one of the best parts of what I do, is to be able to meet our patients and speak with them and actually hear their before, their during, and their after. And it gets pretty emotional in my clinics, at times with these patients that are just, crying and just grateful for their opportunity to relieve themselves of their conditions. But I'll tell you, the one that stands out to me the most is somebody who's become a dear friend, has a child that was born with a pretty serious medical condition. This child is now 9, still has a feeding tube, and doesn't like to eat and just continues to lose weight. So they don't like to use the feeding tube because she's 9 and she needs to learn how to eat, but it's been a real struggle. And along with that, she's got a long list of other parts of her condition. They have been on every single imaginable drug that even has a glimpse of possibly treating this condition that this child has. And the most recent drug that they came to treat her with, which was about a year ago, they said, our last hope and option for medicine as treatment for your child has just been brought to our attention, and we are starting a study in animals, and we'd like to try it on your daughter.
Wow.
And I thought, my gosh, this is your child. Of course you want the best for them, and you want treatment. You want to get them beyond this condition that they've dealt with their whole life. But do you risk whatever, the side effects and everything else that this test may bring on? And at that point, she decided to bring her daughter to Tetra Healthcare. Our doctors met with this family and educated them and gave them really all of the information that they needed to make an educated choice. And they chose medical marijuana as an option for treatment. And I'll tell you what, 6 months after they started treatment, I got a text message with a picture of her daughter actually taking a big bite of a hamburger. And it just brought tears to my eyes. Beautiful. That, they finally got resolved. Now, certainly they've got a long way to go to treat this little girl, but at least this little girl now is able to eat and be able to fight this condition she's suffering from.
It's a measurable progress. And of course, it's non-toxic. And that's the neat thing about there's so many people that have these stories that want to come off of. Sometimes it's an antidepressant, sometimes it's an opiate, sometimes it's a story like you just told there. So medical cannabis is really changing people's lives.
It is, and nobody dies. That's the best part of the story.
We'll talk to you again on a Medical Marijuana Minute from Tetra Healthcare, where
compassionate care and natural health come together.